Hi everyone, Dr. Nemechek here. I want to go over again about this linoleic acid, this omega-6 fatty acids that are in the food supply, and talk about that a little bit. And these are very, very important elements in the diet that's causing inflammation. Now, as I've talked about before, the vast majority, it's becoming quite clear, the vast majority of all medical conditions are being triggered and driven by inflammation. Okay, even if you have a genetic predilection for something in a family, it's still the inflammation that's triggering it. Typically, if you have like a family history of heart disease, it just takes less inflammation to give you heart disease. Okay, that's what that means. And so I've shown you this graphic before. Here's this chronic chemical, or what technically we call metabolic inflammation. And that is a primary factor in causing heart disease, strokes, kidney disease, high blood pressure, autoimmune disorders, insulin resistance, which is actually, type 2 diabetes, fatty liver, Alzheimer's, Parkinson's, macular degeneration, 85% of cancers, all right? And then we over here on the right side, these inflammatory molecules, instead of triggering genes, they cause direct tissue damage. So you have chronic pain, poor wound healing, damage to blood vessels. Now that's what ends up causing a stroke or a heart attack. You can get blood clotting, fibromyalgia. You can see what's on here. And then the main causes are leaky gut, which we've talked about in a lot of videos, autonomic damage from concussions, injuries, or vagus nerve damage. I just put up a video about that. And then in particular, overnutrition. Okay, overnutrition doesn't mean being heavy. It means too much of a particular nutrient, okay, affecting you. And the nutrient we're going to talk about here is this linoleic acid, all right? It is a omega-6. Now, omega-3s, omega-6s. Primitive humans, we need omega-3 fatty acids. They help turn off inflammation, all right? And predominantly comes from fish. You can get some from grass-fed livestock, smaller amounts, but still you can, all right? And then you have the opposite of that, omega-6 fatty acids are what you need to turn on inflammation, all right? And this comes in seed oils, so corn oil, soybean oil, safflower, sunflower, that kind of stuff, and in some livestock-fed seed feeds. This is mainly fish, pork, chicken. Not so much beef, but fish, pork, chicken will have a lot of these omega-6 fatty acids in their flesh that you'll get because of what they were fed. Now, how much of this do we need? Okay, we need, at first they thought about 2%, that number is down maybe 5% of our total calories are required because, remember, we need it to turn on inflammation, and inflammation's a normal, healthy thing. So you need some inflammation, you just don't want it on all the time, all right? And so that's around 0.5 to 2%. Now, how much are we getting? So mid to early last century, 1900s, 99% of the fats in the diet came from animal fat, so saturated fat. And we would cook like with lard and butter, all right? Now, here, by 2005, 86% came from seed oils. So that means in the mid-1900s, only 1% could come from seed oils, all right? And that's how far off we are now. And so it's a huge shift, and it's a big, big problem. And I always, want to mention that this linoleic acid, a high intake of that, gives you a high intake of breast milk. So moms out there, this is important. You've got to, think about this. Here is a graphic showing about the consumption of the variety of vegetable or seed oils. And you see here, 1909, very, very, little. Most of the modern processing for seed oils, that was invented around the time of the Civil War. So prior to that, we didn't really have them. And you can see just the growth in that, okay? And it's major. Now, and this here is the soybean. It doesn't match the color there, but that's what that is, soybean. So it's a huge intake of our consumption of these oils that, again, contain a lot of linoleic acid that turns on inflammation. So basically, we're like pouring kerosene into our bodies, all right? Now, what if you said, okay, I'm just going to get rid of all these oils. I'm going to be very stringent. I'm going to have only like grass-fed livestock, wild fish, all that kind of stuff. One of the problems is the amount of linoleic acid, what we call the half-life, it takes almost 2 years. So if you have 20 times the amount in your body and you get rid of every ounce of this, it takes about 2 years for that number to decline to half. So you go from 20 times down to 10 times the amount. So it's a long haul. It's a long haul to start getting healthier by getting rid of these oils, okay? And overall to get way down, so it takes 6 years of getting rid of these oils before 95% of them are replaced by healthy fats. And it's mainly other things like oleic acid and the omega-3s. Now, same thing though on the positive side, if you have a good intake of DHA and EPA, and say you miss it so you go on a trip for a week and you don't take it, most people tolerate it very well because it's not going to, it has a half-life of 2.5 years. So it's going to change very little, especially in the brain, if you miss like a week. Now, if you're missing chronically, though, it's going to be going down. All right. So you got to maintain your omega-3 intake. But really, so then people are like, well, what do we do? My body's like full of linoleic acid. Well, so here's my oil chart. Here's the very inflammatory ones that you want to totally avoid. These all have some linoleic acid, but they get us way down to a low range. Look, canola's not too bad. Okay, and I'm trying to be practical here too. You can find this in the markets. Olive oil has very little linoleic acid, and but importantly, it has oleic acid. This is what protects you from linoleic acid. So while you've adapted your diet and you've gotten rid of all of these inflammatory oils, all right, but again, that's going to take 6 years to get rid of 95% of that out of your body. The oleic acid in olive oil will protect you today. And it may even shift that half-life of linoleic acid. It may even accelerate that. Because what it does, these fatty acids embed in the cell membrane. And there are things called inflammatory rafts, and you get way too much of the linoleic acid, and that's what will make things more sensitive to inflammation or generate more inflammation. The oleic acid gets into these rafts and competes for the binding sites and displaces linoleic acid, and they'll get burned off as fuel. So one would predict that would lessen the half-life of those bad oils, but we just don't know. I couldn't find any data that's been looked at yet, but one would probably predict that. So, but this is, again, we've got this big inflammatory oil problem, but you just can't just get rid of it out of the diet and think that's it. You got to get the olive oil in because of the oleic acid part. And the anticipated dose, recommended dose, I should say, for adults is at least 30 ml, which is 2 tablespoons of extra virgin olive oil a day. And I recommend the COOC certified oil, that's California Olive Oil Council. And it's the only certification where you have to send your oil in and make sure it's of high quality, and they haven't monkeyed around with it and to make it cheaper. So that's all for today. Everybody, take care of yourself. Get rid of those oils. Olive oil every day. We've got some excellent stuff that we sell called Nemechek Gold. And other than that, everybody have a great afternoon. Thank you. Bye.